How far? Yes, welcome again. Now me, Dr. Frederick Unuigbokhai. People they call me Dr. Fredosta, and I go always tell you say good life na sense. So people they ask me about HIV, HIV AIDS, waiting be HIV, waiting be AIDS. They don't understand waiting it be. Now I say, okay, waiting I go do for you, we say, I go bring one of my friend, doctor, where they do this HIV AIDS matter, most of the treatment and everything is sabi and finish. Now I say make I bring am come. All the whole question wey una don send give me, now I say I go ask am today. So make I bring my guest today for this program, make him come break everything down for this HIV. Him name na Dr. Israel Irobonosen. Dr. Israel, how you dey?
I dey fine o. Una good evening.
Yes, yes, yes. Thank you for deciding to join me today because this HIV matter, I don't get so many questions. Now I say, may we break am for pidgin for people, and may you come help us answer some of the questions where they don't carry give me. I say I go ask you today. Now, the first thing where I want to ask you is say, wetin be HIV? You understand? Wetin it be? Because people do hear HIV, 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 HIV. Wetin be HIV? I better break am down for us.
HIV na virus, na human immune deficiency virus. It's a latent
Okay.
virus. Na RNA double strand virus when they cause
Okay.
HIV disease. And
Okay.
if the HIV disease is not well taken care of, it can lead to what they call AIDS. So now virus when they cause disease to human being, and they affect only human. And now only human in they affect. Yes, we fit get them from other things, but now human in they affect only.
Okay. So now only human being they carry am and a virus.
Yes, na virus.
So when the virus enter person body, wetin they cause? Like when e enter person body, how the thing come dey take cause problem for human being body? Wey be say people they come shout HIV, HIV. How they take happen?
Okay. I go just try break am down, make I not use many English. When the
Okay.
virus enter person body, get many ways when they enter the body. When it don't enter
Okay.
the person body, it gets one of our soldier when they the body, when they call CD4 cells. Now that
Okay.
cells, then they affect. And that cells now one of the cells when they tell every other cells, every other soldier, may they go fight war. Now that
Okay.
soldier now they tell every other soldier for the body, say, bad person don't come, make we ready to fight them. But the HIV, now that particular cell, now they affect. Not be saying only that cell, if you say affect another soldier, what they call the dendritic cells, if you say affect the CD8 cells. So these are the
Okay.
cells where most of the cells when they affect. And when it affect, it will help to reduce the immune system of that patient. Because when the soldier when supposed to tell that soldier may go fight, not confident tell other soldiers, they not go fight. So from there, it will come release the own property, enter the cells, the human being body, and then you come they multiply, they grow. And as they grow, they kill every other cells, they make the body they expose for other disease to enter. So now so they do in your work.
So means say the virus they go fight the immune system. Now the immune
Yes,
system
they fight the
now
immune
the immune
system.
system they go target. So when the immune system go down, go come cause problem for people body.
Yes. That's
Okay.
so it just be.
Now, so this one I want to ask you now, they very important because people don't really talk many things. How people fit take get this HIV. So make you help us break am. How person fit take carry this virus for him body? The different ways wey be say this virus fit enter human being body. How?
Okay, many ways they when person fit get this virus. I think I go just list the
Okay.
one where they very important when with the quiz C. One of
Okay.
them through the commonest when many people where they affect so many people now through sexual intercourse. And so that one are the commonest. I will say having sexual intercourse with somebody where you not know the status without protection. or having some intercourse with somebody where they HIV positive, where not they take medication, or where viral load they high without using, when you not use protection, you not use any, you not use condom, you not protect yourself, you just go sleep with the person where you not know his status, or the person where you even know the status, but the person not they do well with the medication. So that na one way when person fit take get am. Another way when person fit take get am na through wetin we dey call mother to child transmission. That na vertical transmission, where e be say the mama na im give the pikin. Most of the time dey happen during childbirth, during pregnancy, and sometimes when they give the pikin food. It fit happen during through this means. Another means wey dey a little bit rare na through blood transmission, blood transfusion. When you give somebody blood wey they no screen very well for HIV, you can't transfuse and give another person. The person fit still get the virus through that means. Another means wey dey common sometimes for health workers na needle stick injury in the workplace. They treat somebody when you not know the state, you mistakenly chook your hand with the sharp. You not do the normal thing when you supposed to do to protect yourself. Some persons don't come down with the virus with that, through that means. Even using person wey go do surgery for person wey you don't know whether the person get the virus, or even when you know, you not take the normal precaution, the normal care wey you supposed to take care before doing those things. You also fit get if you even transmit the virus to himself, or even to the person, or to even to the next person. Also, accidentally people can get it. I get case when I notice, when I don't see, not be say I notice, when I don't see, when be say the person passenger for bus where get accident, another passenger where did the bus na HIV positive. As far two of them did the same bus, they get accident and their blood meet to each other. The person actually carry the virus from that means. So I call that an accidental. We call it accidental discharge because not be say waiting. It didn't come on like that. But the few ones I've mentioned, the ones when I don't fair mention, and then they come on pass when person fit get the virus.
Before I go for them, I want to ask one very important question for somebody where they listen now. HIV na death sentence, because whenever people hear say you don't get HIV, person will just say my life don't finish, or my own don't end. HIV na death sentence.
No, HIV not be death sentence. HIV they manageable. So we dey fit manage HIV. Only say HIV not get cure. So HIV not be death sentence, because medicine dey, medication dey when person fit take, and when make the person dey alive till as he wan stay alive. So that one make us know say HIV not be death sentence. Yeah.
HIV no be death sentence. Okay. Now, as you don't talk how person fit take get HIV, so what if somebody can't shake person wey get HIV, or he use person wey get HIV, he use the towel, or maybe then sit down together, person fit carry HIV like that?
Okay, that one they cause some misconception about HIV. Okay, we get so many misconceptions, and this one are one of them.
Okay.
When if you know, when we know want to say HIV, they're not right for anybody forehead. So if you want to say because you can't know say somebody get HIV, if you shake and you get HIV, not lie, because you don't shake so many people, you never can tell whether they get. So HIV they're not the fit transmit HIV through shaking, or you embrace the person, you know if you get the HIV, or you use the person towel, you know if you get them, or when I eat for the same plate, you know go fit get them, or use the same spoon, maybe in the finish, you wash the spoon, you carry the same spoon to eat, you know go fit get them. Even when you kiss the person, you know go still fit get them, except maybe the person get wound for mouth and you get wound for mouth. But why you want to go to kiss somebody where you get wound for mouth? Normal kiss, you know, if you get that, or except you want to drink 1 gallon of the person's saliva. But that one not dey possible. So you know go fit get that through those means at all. you not go fit get am.
What about
Even
what about
sleeping
for
for
food? Say
the same
for food.
person, you not go fit get am.
What about for food?
You say
What about for food? Because you get one
food?
video where go viral. Say somebody put in blood we get HIV inside. Say people drink the blood, maybe they fit get HIV. And people will not tell them say there is no way you fit carry HIV for food. I better break am down again.
Okay, now for that one when you say person put blood for the food wey dey sell or those things, remember the virus no dey stay alive for ground outside host for a longer time. After a short seconds, after a short minute, e go die. So na except e dey inside human being body, na e dey fit stay for a long time. So and another thing, the virus no dey stay alive for hot weather. So imagine those food fit dey hot, or maybe na when e cook na e put the blood and e go cook the food, and those virus go die off. So e no go fit transmit am through those means. E no go fit transmit am through those means as well.
Very, very good. Now we wan enter another area, and this one na the symptom of HIV. The symptom like this, how person fit take know or wetin person go see if person get HIV for body. Because I don hear question, e be like say I don carry HIV o, be like say I don carry HIV o. How person fit take know say all these symptoms wey dey na HIV symptom?
Okay, wetin you need to know that HIV get different progressions. Okay, maybe I'll talk this one when I wan talk later. For the signs and symptoms of HIV, first thing first is that HIV fit be person fit get HIV for a long time, e no go know. So e no go get any symptom, e no go get anything for body. E go dey live a normal life. So e no go know say e get the virus. So that one na one. So now when you go for normal testing, maybe you just go test yourself. So some people, I get one patient wey be say na when he wan transfuse, they look for blood to transfuse to a family member. Now he go test himself. Now therefore know say he get he not get any symptom as at that time. And another, but these common symptoms when they get now like symptom of malaria. So people where they get cold, their body they hot, that they get headache, that they tired easily, they not they feel eat all the time, that they get all those things all the time. There are people with malaria every time. You still supposed check for HIV. Now another symptom when you get now, person go dey purge, and when you don't purge for more than 2 weeks, the person feel need to check for HIV. Now another symptom when we dey quick check, now if you look the person tongue, you tell am make bring out the tongue, you notice say e white. Yes, if we see that kind of thing for person tongue, we go see tell the person make it test for HIV. And because these are so many things when person feel they see when the person gets HIV. Some person go come notice say that they lean well, that they slim, they not get weight again. Overnight, within short period, they don't slim once. That person, we still need that person to test for HIV. Now, may you know what all these things when they talk, not miss other sickness, not forget them. Other sickness forget them. But once you see these things, you still need, if as you check for other sickness, you still need to check whether the person gets HIV as well. Another one are cough. The person go they cough. That person can get TB. TB and HIV, they be like 5 and 6. So whenever you see TB, you they look for HIV. You go quickly go check whether that person get HIV. And wherever you foresee HIV, you they quickly go check whether the person get TB, because they be like 5 and 6. So when person they cough, apart from you doing TB test, you still need to do HIV test for that person. So this one are some of the signs and symptoms when some people go bring comment when we'll take go check whether they get HIV. Another one they go get rashes, crocro. The crocro fit follow one line of their body. If they notice that kind of crocro, yes, now also sign say make they go test for HIV. Majority of the persons when they get that kind of line that kind of line, majority of them, they often they always they come down with when we test them with the most of the time they notice that they always they take positive to HIV test. Another one na wetin we dey call WATS, vagina or the anus. They will
or
get
genital
something
warts
like
or inner warts.
small boys. Dr. Fred, you there?
Yes. I dey hear you. Continue.
Okay. We're going to say something like we dey call am WATS. It go dey the either the nyash or the for women the vagina, for men the penis area or the bronchus area. You go see them for there. It'll be like small seed. Sometimes some go gather together, many seed like that. They go come out like some go be like spider web wey gather for one place. When you start to see all those kind of things, you need to also check for HIV because sometimes some people will get those kind of things that they get HIV. However, not be all of them will get those things get HIV. So if you see those things, not mean saying it must be HIV, but they are all signs and symptoms of HIV.
Very good. Oh, this one now, I want to ask one question. What will be the difference between HIV and AIDS? Because you go here say HIV
Okay.
dey o, you go here say AIDS dey. Wetin the difference between this HIV and AIDS?
Okay, I know there's no different really, Shao. There's no different. HIV just be like the pikin wey never AIDS na the pikin wey don grow. HIV na the pikin wey never grow. No, before I fed dey 2 years, later I come be 5 years. Now I don mature. Na so that one, na so e just be. HIV na when e dey 2 years. Then AIDS na when e don mature finish. Now, HIV virus, infection get 3 progressions. It's divided into 3 progressions. We get the acute phase, we get the latent phase, and we get AIDS. The acute phase now within the first 8 weeks when the person just new gets the virus. And during that place, the person will get some malaria symptom or catarrh symptom. And after that time, the body go just try fight all those and if you not get any symptom again. So most people not go even know say na HIV na give them those symptoms. That are the first 8 weeks when they just dey infected with the virus. So some of the time they not they know. So the latent phase they last for many years. Even though you not take drug, you can last for like 10 to 12 years, even without for the latent phase. That time the body be like wetin don hold the virus. For those with a good immune system, the body don't hold the virus one kind. Not be say e kill am or e just hold am somehow. E just be like say they don't turn small friend. So the person go just dey like that. Now you know what they call tip of the iceberg when they see for river when you see small block for up, but wetin dey inside e big well. Now that one they happen for that latent phase because you know they see anything, but you don't know say wetin dey under e big well. Before you know wetin dey happen, e don grow to become AIDS. So AIDS na just the maturity of HIV. Now so I think that will be the best way when I go take explain am. So for person wey don get AIDS, within 2 years the person fit die if e not treat himself. However, even when the person don reach that mature stage, and e start e drug, e go fit well again. That make we know say HIV not be death sentence.
No be death sentence. As you don't mention treatment now, make we just enter that area because I be no enter there yet. So let's talk say somebody now go do test for HIV. As he do test, it can't come out now say the result dey positive. How make the person waka? Waiting the person need to know and waiting the person need to understand for the treatment.
Okay, when you do your test and you find out say the person find out say dey positive. Now, when you do your first test and it's positive, most of the time we know they say this person dey positive. We go need to do the test again. So we must retest that person. Yes. because sometimes how the first person take do am, e fit wrong. So another person need to retest the patient or the client again. Now when that other person don retest the patient again, that is when we fit talk say this person dey positive or not. Now we no dey use only one strip, I call am strip, one test kit take test that patient. We no dey use only one thing take test the patient. We get different kits, so we dey use at least 2 of those kits take test the patient. And if those 2 kits, we call them determine, we have 3 kits, we dey call them determine, Unigold, and start pack. So out of those 3 kits, we dey use mainly 2. If 2 for those 3 kits say the person dey positive, e mean say that person dey positive. But if 2 of the kits say the person is negative, it means say that person dey negative. That is why we not just dey do one test, we just say this person dey positive. We must use at least 2 of those kits. Once the 2 say the person is positive, it means say that person dey positive. And even though when one person don use 2 of these kits and is still positive, e go still carry that person go give another person to do the test with another of the person, change the hand of the person, use another part of the person blood, take do the test to find out if na wetin the first person see, whether na truth or not. Because once you start the medication, na for life, na the person go take that medication. Very careful. And we dey very, very careful to say this person dey na HIV positive. So when we don do test and the person is positive, if na ordinary place for go do am, ordinary place suppose refer this patient or this client go centers where HIV drug dey. And most of the center where HIV drug dey, most teaching hospitals get am, most general hospitals get am, some big hospitals get am, many military hospitals get am as well. So when you go there, you go ask for where you go fit take HIV drug. They go direct you, or just ask where you go fit do HIV test. They go direct you go the place. And this test and the drug, everything are free. You no go pay 1 naira. That is if you go do one for the place where the center when they do this test. That is the main centers. When you go do one for there, na free. Then you no need to pay 1 naira. Even the drug na free as well. You don't pay for the drug. So when you reach there, they go accept you. Counselors dey, people wey dey advise people, wey dey talk to people, not dey advise, wey dey talk to people. Then they go follow you talk. They go calm you down before you go meet the doctor. Then the doctor himself go follow you talk. He go come start you on the drug wey you know say good for you. After you don do 1-2 tests to be sure say your kidney dey okay, your liver dey okay, your blood level dey okay, and you no get hepatitis and all the other things, then they go start you on your drug. Even those tests not stop you from starting drug. So we'll start you on your drug and give you appointment for you to dey come all the time. Come see the doctors.
Now, what if say person can't start medicine, he start the treatment, person can't talk say, I don't start, the thing don't go down, I don't go continue the medicine. What if it happen?
Okay. Now this virus a big grow well. Now because the person dey take the drug, now make the virus reduce. But once you stop to take your drug, the virus will start to grow again. You remember we thought say this virus don't get cure, we the only manage. Yes. And the only way we will take the manage now for you to take medication, your drug every day. Now, for this country, yes, we still get now drug we will take every day, 9 days. However, outside this country, in the US, they don't advance, reach some part where be saying an injection that they take. When you go, you take the injection once in a month or once in 2 months. But for now, you never reach this country. So the one we'll still get for this country now, tablets where you go, they take every day. We go tell you take every day, the same time every day. If you stop the drug, say you don't tire because your viral load come down. Viral load come down not mean say you don't cure. No, it not mean that. It means say the drug they work well for your body. It also means say the virus not dey fit divide well. So and all the virus they hide. And it means say you dey healthy. So once you stop the drug, it means say you don't lose guard. Don't say when you dey go fight war and you lose guard, wetin go happen? Your enemy go get up and go kill, he go start to dey fight you again. So now make even when you kill your enemy, you need to block that road well. And how to block the road? Now to continue to dey use your drug so that the virus no go fit get up or come get up say he wan follow you fight again.
So when person start medicine and the thing don't go down, don't be say the person go come talk say, I don't cure, I no go back to go take my medicine. You must continue because the virus don't go down well. They don't fit test them. You get one thing where they popular, say you is equals to you. That time you is equals to you. Help us break am down. Wetin e be?
Now we get the term what they call you is equals you. The first you mean undetected is equals to untransmissible. Wetin e mean say if you dey take your drug very well,
Yes.
you go get where you go reach. The virus will not go see am for your bloodstream again when we do your test. And the test what we dey do, we dey call am viral load. When we check for your viral load, we call am viral load test. When we check how many the virus dey for your blood, you get where you go reach say the virus will not go see am for your blood again. But that one not mean you don't cure, because that wetin e mean say the virus don go hide. So you know dey fit do any bad again. You just go hide, go stay there, dey wait whether you go lose guard. So when you don't reach that time, now that time we dey call undetected. It means say we not see the virus. The machine wey we take do your test not see the virus. And when that person don't reach that stage, it means say that person no go fit transmit the virus to another person. That make we say undetected is equals to untransmissible. It means say because the virus don't dey very low, that person, even when he sleep with another person without he not use condom, he not go fit transmit the virus go give the other person. That make we say make them they take their drug well so that they go fit get to that stage. And that through that means that make some husband and wife when not even one day positive. That make some two partners when we say one day positive, one day negative, that they fit stay because one they take a drug well and that one day positive, the other one go remain negative. That one way when they fit dey negative.
Oh, meaning say person wey dey HIV positive fit still even marry person wey dey HIV negative, and the person wey dey negative, you know, carry the virus.
Yes, person wey dey positive fit marry person wey dey negative, and the person no go carry the virus, e no go affect am. And the only way that one dey happen na in two ways. One, you wey dey positive must dey take your drug every time so that the virus no go dey detected for your body, then you come become undetected. And when you make love with your partner, you no go fit transmit am, then it now become untransmissible. Another way when you don't want the fit happen na the use of one drug when we dey call PrEP, which is pre-exposure prophylaxis. Na drug to prevent, na drug when we dey use to take prevent HIV. We dey use the drug to dey prevent HIV. So one of the people who they give that drug now this we they call discordant couple. Discordant couple mean one of the couple now HIV positive, while the other person now HIV negative. So that HIV negative person now go they take that preventive medicine, that PrEP, what would the drug what would they call PrEP? It go they take as long as the person will be positive they around with time. Then when the person not there around, if he stop the drug for the main time. So with that, you feel marry somebody where they positive and you not go get the virus, you will be negative. I get many clients like that. I get many of them where we see one of them they positive, the other one they negative. Even recently, I even get one new one when the woman is positive. The woman was afraid. Hey. The husband they negative. and they are still married, and the man is in, he not even mind. He say, abeg him for na today, not be me and you dey together for 8 years, you not give me, now you wan give me. So they are living happily. The man still remain negative till today. The woman is still positive. All the children when they born, all of them are negative, because the woman they take a drug and they follow the normal things where they suppose to.
Very, very good. This one are good information. So because a person say he get HIV, no mean say he no fit marry, he no fit live in life. You can have HIV and you will live your life, your best life.
Yes. You have HIV, you can live your best life. It not spoil anything for your body. Now just say you get the virus. As far as you take your medication, you can live your best life. You feel do anything when you want to. But everything you must do in a moderate form. That's just it. Even people will never get the virus, we see they tell them live your life in a moderate form. I never see any doctor will tell say because you not get sickness, go to drink anyhow, or go to smoke anyhow, or go to do every nonsense thing anyhow. They must go to do everything anyhow. They must tell you say you do all of them in a moderate form. Dr. Fred,
Not true you talk.
So because of that, even when you get the virus, now the same thing we go see tell you. Do everything in a moderate form and you will live happy. Nothing will do you.
Now, maybe go to one very important area. How person fit take prevent himself, make he no catch this HIV virus. Say, okay, see, make we protect ourselves, make we no carry the virus. How person fit take do am?
Okay. In prevention, we get what they call A, B, C, and D. A, B, C, and D. A mean abstinence. That is, not do anything we go make you get the virus. If you are not sexually active, remain like that, except you are married and all that. Abstinence. Well, we know say that one not today common again for this world. People know the 2 feet. No, not be everybody they abstain. Now that one can't bring about the order. B is be faithful. It means say may you be faithful to one partner.
One man, one vote.
Say,
one man, one vote.
Yes, one man, one vote. And also that your one vote should also be only you. That is, as you are being faithful to him or her, he says should be faithful to you. So now just be 1-1. And una two know una status as well. So una two na negative or negative positive, anyone. But una two know una status and you are faithful to one partner and your partner is also faithful to you. That na B. C now they use, because some people to become faithful don't wahala. So because we don't find out not everybody they faithful, the C can come to play. The use of condom, because condom can prevent HIV. Apart from preventing HIV, it can also prevent some other sexually transmitted infection. Can also prevent gonorrhea, syphilis, and all that. Condom go fit prevent that and go prevent HIV as well. So now I bring about the use of C, so that we go see if we prevent ourselves from coming down with HIV. Then when we can come out from there, we can go D. D now the use of drug. We find out say some persons not like condom. Some go say if they use condom in all the space. Some go use condom, they go get condom break because they don't wear the condom very well. Also, some other persons they feel rape them. And you know, people when one rape person, sometimes they not they wear condom. In fact, most of them not they wear condom because they want to do a sharp. So because of this set of people, mostly are rape victims. Because of this set of persons, now they come to play the use of drug. And we get two aspects of this drug when we they talk about. One are PEP, the other one are PrEP. PEP mean post-exposure prophylaxis. That one are drug wey be say people when they're already exposed to the virus, but they are negative, go fit take so that may they not become positive. And that drug, they good for that drug, rape victim, and that drug, they very important for them. Because who rape them, we don't know their status. So you need to give, so that it means that they already they exposed. So you need to give them post-exposure prophylaxis. So we'll give them that drug. People, when they work for hospital, they get needle stick injury, they're already they exposed. We also need to give them that drug. People who use condom can't get condom break, they're already they exposed. Maybe they don't know the status of their person where when they sleep with. They still need to use PEP, which is post-exposure prophylaxis. People when they use condom, and they are not faithful, and they don't even know the status of the people when they meet. Yes, if it happen once, we go tell you, say, may you can't use post-exposure prophylaxis. That's one of the drug. Then the other drug, we call it PrEP, pre-exposure prophylaxis. This one a drug when you go take even before you expose yourself to the to anything wey go fit give you HIV. So people when they take this drug now, people when they at risk of becoming positive. So they are not positive, they are not yet exposed, but they are at risk.
At risk.
That this they can become positive. And these people are people when marry HIV positive people. That are one set of the persons we go fit take that drug, because that person when they marry put them at risk of becoming positive. So to make sure say they're not positive, one, they go make sure say their partner they take their drug very well, and two, they go dey on PrEP. That are one set of people. Two, men when they sleep with men, they still dey at risk. Injection users, those people where the drug users, injectable drug users, those where they use drug through the vein. You don't say when they don't inject themselves, sometimes 5 people feel use the same needle. Sometimes they not even remember. As an inject, you give the other person. One of them feel get the virus. So they are at risk of becoming positive. So those are now another set of persons when would they give the drug. Another set of persons are people who get multiple sexual partner. They get many people when they sleep with. And for those people when they sleep with, sometimes they not even use condom for all of them. Well, they feel they use condom, but they experience condom burst. So those people still need the drug. Or even somebody when you know say your own partner gets many other partners. He himself fit decide say abeg, he not fit for wahala. He go take the drug to prevent himself, because if the other partner fit don't go bring something come from outside, come give am. So those are people. So another people when they use this drug, now people when they come down with infection all the time, sexually transmitted infection all the time. You treat them today, you come down again tomorrow, you treat them again. Every time they come down with infection. Those kind of people, we see they give them PrEP. Why? Because it means what they do can also put them at risk to get HIV. It means they not use protection. That means that they always come down with sexually transmitted infection. Another set of people who they give now, people when they use sex till they make money, that is the sex workers. So we see they give them this drug to make sure say to prevent them from having HIV. We they call them PrEP. And in their hospitals, general hospital, teaching hospitals, and some military hospitals, army hospitals, they there. You can access them and get this medication. And all of them are free. You not go pay for them.
I like this one where you talk, say na free and they no go pay. Because people go they fear, think say they will collect their money, me we no get money, I will go pay. So this one na free, abi for general hospitals, teaching hospitals, military hospitals, abi?
Yes, even big private hospitals they give. And Even the HIV treatment are still free. Just to know that one.
Very good. Okay, quick. I know what make them too long because this thing, you don't really break them down. More we talk about the test now. Who's supposed to go test himself for HIV? Who need this testing? And who need to carry out test? And how many times people supposed to do this testing up and down?
Okay. Everybody need this test. Everybody. Papa, mama, children. As far you know say one or two, you dey exposed to one or two things, you need to do this test. Even people where they work for hospital need to do the test. And because most of them where they see blood all the time, they need to do the test. If you know you are sexually active, you need to do the test. Even though they're not sexually active, safe. Because we know say not be only through sex that they get the virus. Other means they, as I earlier said. So people can get it through many different means. Even when people will make hair safe, all those needles, the madam will make your hair get the virus, it mistakenly chook in hand, it bleed the blood. As they do your head, you chook am for your head. Anything fit happen. So now make everybody need to do the test. And how many times you supposed to do the test? Within you are supposed to do the test at least within every 6 months, 3 to 6 months. So if you do it now, you need to count like 3 to 6 months to repeat the next test. So if you want to look at for a year, roughly at least 2 to 4 times in a year, you fit don't do your test. So for you to even fit yourself say yes, I'm HIV negative for this year, you must have done your test at least twice in that year. So when you don't fit do your test at least twice, because I say every at least six months, before you to do your test. So if you don't fit your test the first time, within the next 6 months you did your test again and you are negative, yes, you can actually say for that year, and not say for the whole of your life, for that year, you can actually say yes, you are negative. Yeah.
One other thing again before we round up quick. I hear say then get how person fit take test himself on his own without even going to hospital or going to a lab. Help me break them down. Help us break them down.
Yeah. We find that say many people know they like to come and contest themselves. If you tell them say come and do HIV test, people come they look me one kind. People come they look me one kind because I can't do HIV test. Because of this stigma and all that. Now we come, and some people know they like me, they check their hand. They don't even want to see their blood at all. So another means, another technique can come out when they do this testing. And they call the kit self-test kit. This one you don't need to use blood to do the test. This one you fit do one by yourself. So this one for you to your common hospital. They will teach you how to use the kit. They will give you the kit. You go carry and go ask. You go do the test by yourself on your own, and you give us your details, and we'll give you our number. You go call us to let us know the result of the test. That is just it. So we dey call am self-test kit, which you do the test by yourself. And what we tell they do on your saliva that we dey use. We go give you the kit. You go if you go put am for your tongue. It not be your tongue, your gum. You can pass through your upper gum and your lower gum. When you use and pass your upper gum and your lower gum, you get one water with they call a reagent. You go chook am for inside and wait for like 20 minutes before you read the test. Now the test can be positive, it can be negative. If the test show positive, we know they say you be positive 100%. And we go need make you come hospital. Come do confirmatory test. Now that confirmatory test, now we go fit know say yes, this person are really positive or not. If the confirmatory test say positive, it means say that person are positive. If the confirmatory test say negative, we do the other following tests, all of them say negative. We go tell this person say you be negative. Maybe you not follow the right procedure and the right process. Now make that one show positive. Also, this test, pikin wey dey less than 11 years, no dey do this test. No dey use the the self-test kit. But when you come hospital, go give you more information about the self-test kit. But just know, say you go fit test yourself by yourself. You now for you to come say, I need that test when I'll fit do by myself. When I want to do HIV by myself, we go give you. You fit even carry go give people for house. When we don't train by your use and you go train them for house, and all of them go do the test too. And when they get the result, they go let us know.
So that means a person no fit just go buy am for pharmacy. You know the pharmacy to go buy like that.
You know, say I don't better una say all these things now free. However, yes, some big pharmacy or some big place fit get am and they fit sell am for una. But if you go centers when they treat HIV. Hello, Dr. Fred, you there? Dr. Fred,
I hear you. I hear you. I hear you loud and clear.
Okay. As I said, if you go and some place they some pharmacy, they fit get am and they go sell am for you. However, if you go centers when they treat HIV, big hospital, general hospital, teaching hospital, some big private hospital, military hospitals, these tests, these things now free. They go give you free of charge. They not go request me you give them ₦1. But if you say na pharmacy you go, I don't know whether they get them, but I only tell you where you get them free of charge.
Omo, you don't break this HIV talk for us today. You don't tell us wetin HIV be. You don't talk how people they take get HIV, the difference between HIV and AIDS, the symptom, even the treatment for person wey test and the thing show say e be like say e positive, wetin the person need to do. Many things, and e dey very good say as people watch this video, so make they share and make other people know, because ignorance don't make people don't go kill themselves. I hear one person wey go do test because yes say e get HIV, the person go kill himself because the person no get enough information. Now, as we dey round up, which final message you get for our people, make them know concerning HIV?
Okay, now let's two things I want to talk so that make it for not too many. One, HIV not be death sentence. Two, HIV not get cure as of now, but with the fit manager. Three, I be say two, but may add this one. If you test yourself, say you dey positive, I beg, go hospital. Hospital when you know say that they fit treat this, that they fit give medication to this disease, and go start treatment. HIV treatment na free, and no, HIV not the show for face. Make you notice say now only you and get am. Many people fit get am. If I tell you the number of people who get am for this country alone, you will be surprised. Even for Lagos alone, if I tell you the number of people, you will be surprised. May we not all go there for today. May we not say, may we not come to talk numbers. But HIV, not the show for face. So, not be death sentence.
No be death sentence. HIV no be death sentence. HIV no dey show for face. Many people get am, and you get HIV, you fit still live your good life. If you get HIV, you fit even marry, live your life, nothing. All you need to do now, make you avail yourself, go take your medicine, follow all the advice wey dem give to you, and make sure say you carry your test. Now, Dr. Israel, I know say for your social media page, you dey drop all this kind message for HIV. You dey drop am small. Abeg, call your social media handle for where you dey. Na Instagram, na TikTok, just call am so that people wey wan fit ask you questions, they go know where to find you. Abeg, mention am.
Okay, if you want for my social media page, the name we just did that place, so now you fit get me for my Facebook, Israel Doc. And for there, I put one message on self-test kit. How you go fit do the test by yourself for HIV. That message dey there as at now. For TikTok, now Doc Israel, Doc.Israel, DOC, full stop, then Israel. You go see that one for TikTok. So, and I still put some videos about HIV for there. In fact, everything when I dey talk about most of the time, I about HIV, because I know say most people not get the knowledge, and we know say knowledge is the key to so many things. Ignorance make us dey do so many funny things, and now make I just decide say, man, I know so many people not get the knowledge of HIV, even though some people think say they get. It is good to always let them know when there is even a new update. I let people know. Even now, December 1st is World AIDS Day. That is next tomorrow on Thursday. And the theme for this World AIDS Day now, the short form, equalize, equality. That is, we dey make sure say everybody get equal treatment when it comes to HIV. Get equal treatment for equal right for testing, equal right for treatment, and equal right for prevention. We not dey see say this one a woman, e not get the right. We not dey say this one a man, e not get the right. We not dey say this one a small pikin, e not get the right for testing, or this one a small pikin, e not get the right for treatment. No, everybody gets equal right for testing, treatment, and prevention of HIV, because we don't know say if we equal right to everybody to take themselves, we go fit stop the spread of HIV come 2030.
Chai, Dr. Israel Irobonosen. I don't know. I could just say make everybody just they clap for you, as you take break everything down. As you break them down, where our prophetic understand. I want to say a very, very, very big thank you to you. And which one will go try beg people now when they watch you say, I beg, help us share this video. Share this video, because remember the greatest sickness now ignorance. People will not know, and you even worse, people will get the sickness. So I beg, help us share this video so that all these people we don't talk for you, it no go waste. And then we go break this video down, put them for social media, and put the full video for YouTube so that people go come learn. You know my handle, Dr. Frederick Unuigbokhai. Now so it be. I always tell you, good life now waiting. Good life. Good life now sense. Dr. Israel, thank you for your time, and I appreciate you so much. This HIV matter where you don't start, I pray say people will hear you well, and the message will go far. Thank you once again, and have a wonderful day.
Thank you. Thank you.
Thank you. And you will watch me right now. I just want to tell you thank you for watching. Another time again, we'll go do another video like this. We'll go break things down for you, make it long so that you go come hear everything, and we'll go see you later. See you. Good life. Bye bye.